Yes, sir, please.
Good morning, everyone. Dr. Deepak Megut told that he is junior to us, but I think he is much senior to us as far as these skills are concerned. So, all respect to Dr. Deepak also, I would be talking on this Chote Mia. So, you all know that the advancement in technology and the IELTS has made the cataract surgery no less than a refractive. It's not coming. It's not coming. So advancement in technology and IOLs has made cataract surgery no less than a refractive procedures, and each step requires perfection and precision. And capsulorhexis is one of the most crucial steps of phaco emulsification, and a proper sized and shaped and centered capsulorhexis or capsulotomy is quite essential to not only for the subsequent steps of the phaco, but also to have the lens in the perfect position and in the effective lens position. You can see there is the capsulorhexis manual capsulorhexis done in some of the cases. Do you expect that you put multifocal IOLs in these patients? Never. And mature cataract with intumescence is always a challenging scenario in all of the most of the time, and not everyone is so talented or so I would say that skill that everyone get away through that. You can see this can have this much of this type of problem very often, but obviously there are various ways and means to counter that, but still it can. So there is no way to have a reproducible capsulorhexis, round capsulorhexis in these patients of mature intumescent cataract in many times. Femto, on the other hand, is known to have a very good precision in as far as capsulotomy is concerned, particularly in cataract which is not so mature in intumescent. But there are reports that there are chances of microadhesions in complete capsulotomy and sometimes anterior capsular tear also. And because of its large size and the need for eye docking and the various other things, it requires actually longer time and change in the surgical sequence also. And not only that, is very initial high cost, and the subsequent costs are so high that it's not possible to afford each and every one of us. On the other hand, Zepto is, you can say, is midway between the two, which is able to give precision almost 99% of the time, even in all types of cataract, even with the cataract with corneal opacity, and it requires very less time. It doesn't actually hamper the surgical sequence. This small video clip, this is my first case of Zepto, so I can proudly say that there is no learning curve associated with using Zepto, and you can use it in any type of cataract. Only thing is that it requires a little more expense on the part of the patient, and the capsulorhexis stage is very smooth. Even it's better than the Zepto, better than the Femto, and capsulorhexis edges are even stronger than the what we get in the Femto also. So if you compare all three procedures, it is Zepto scores almost all parameters. Zepto scores better than the others two, but definitely it requires more expense on the part of the surgeon and more on the part of the patients also. So Chote Mia definitely has a role in case of mature intumescent cataract. Thank you so much.
Thank you, Dr. Subhash Prasad.